Living in Grace. I'm so glad you tuned in, and I hope you will contact some of your family and friends. They may go to our website at www.ggcstl.org or to Facebook Live. Tonight I have with me my guest, Dr. Lannis Hall, who is an oncologist and who will be talking to us about a lot of different subjects. Because right now in our state and throughout the nation, everybody's beginning to relax about what they can do or not do socially. But COVID-19 is still here. And that's why you see there are some states that are spiking, some states are not decreasing. And we want to talk about it because we want everybody to stay safe and well. So I welcome again Dr. Lannis Hall. Glad to have you.
I am so happy to be here and
Good.
thankful that we have made it to June together. But you're right, it's been a hard road. Since I last talked to you, we were just beginning to talk about face coverings. I want to say that it was the first week in which you had a Facebook Live and we actually had face coverings on. And now I feel like we have corona fatigue, in the sense that we went through March, April, and May, really sheltering at home. And we were told the importance of social distancing, of being 6 feet away from others at all time when we're in public spaces, the importance of not going out in public when we didn't need to, and the importance of face coverings. And I think we probably should revisit why this hasn't gone away, these important guidelines, just because, well, we had to reopen. We need a paycheck. People need to work. And I think when businesses reopen and you see cars on the street and your restaurant, your favorite place is now open, you feel like, well, let's get back to normal. I know I've felt that way. And you have to say, this virus hasn't gone away. We may be over COVID, but COVID isn't over us.
Right.
And that means that we now have to continue, even if we are going out more often, to think about where we should go and places we should just stay away from.
Now, because the one thing that has fascinated me is that knowing that we should have social distancing in groups of 10 people or whatever, we should be wearing a mask, as we're wearing right now, masks. But I've been shocked to see when I go different places or drive different places, how many people are mass gathering and not using a mask nor using social distancing.
Yeah.
And I think that's kind of giving people the idea that everything is okay.
Right.
But reality is not okay.
But,
So how long should we be doing this?
well, first of all, let me say that I think if we had a consistent message from our leadership on down about the importance of face coverings, we wouldn't have so much confusion about if we should be doing it or not. Multiple studies have shown that the main way that this virus spreads is through respiratory droplets. And respiratory droplets occur when we are singing, coughing, sneezing, talking. And the best way to protect ourselves from respiratory droplets and to prevent any respiratory droplets from getting into the air for others is to wear face coverings. And I want to go back to something I talked about before, and that is asymptomatic and pre-symptomatic. There have been several studies now, state studies, nation studies, Iceland, Boston, that have cruise ships that have all said that, you know, if we mass test, we may find in a community 40% of people who have an infection who may not have any symptoms. So the definition of asymptomatic is You have been tested and it comes back positive, but you have no symptoms, no temperature, no cough, no shortness of breath. Pre-symptomatic is you don't have any symptoms at the time that you were tested. The test comes back positive, but you later on develop symptoms. So pre-symptomatic means that you develop symptoms in the future, but you are still able to be tested and positive prior to those symptoms developing. What we know is that you can shed virus significantly before you show symptoms. So pre-symptomatic people, if they've been walking around and on Sunday they get tested and they're positive, but on Friday and Saturday they've been to 13 different parties,
Right.
then all of those people are potentially exposed to the virus. And the best way to make sure that you don't become someone that has infected somebody else, one is to not be in situations where you are sitting next to someone. You should be always social distancing in public spaces, 6 feet away. And you should be wearing face coverings. And it's best to be outdoors. So if you said, I'm just tired of this, what is the best way for me to socialize with my family? Because we haven't seen each other since February.
Right.
Well, probably a lower risk situation would be outdoors, social distancing in a picnic-like fashion with chairs 6 feet apart, having a barbecue, talking with your face coverings on. We know that when we have super spreader events, those are events where multiple people get infected from being together. It's usually indoors without being able to social distance. Many of these people feel fine, so no one's saying I was sick, coughing, and sneezing. They feel fine, and they are close-knit. So for example, down in Florida, those women who were at the birthday dinner where all of them were infected. No face coverings, sitting close together for a long period of time, laughing, enjoying each other, but spreading respiratory droplets because you're laughing, talking. And so all of that, all you got to do is think about it. Is it crowded? Am I wearing my face covering? Am I indoors? Crowded, wearing my face covering, am I indoors? If it's a crowded space, no one's wearing a face covering and it's indoors, that's the highest risk situation. So I really think because we opened up and because there has not been a consistent message, and let me just be clear, I won't move into this because I know people don't want to hear it, but this has been politicized, that there's something wrong with being safe. But let's remember, when you're wearing a face covering and you may be asymptomatic, like a younger person might be more likely to be asymptomatic, but not completely. They can get very sick too, but they might pass it to their parents, their grandparents, or someone older, or someone who has a health condition that puts them at risk for, if they develop it, they could have a serious outcome, like heart disease. Lung disease, being immunocompromised, having asthma, all of these, or history of cancer, all of these issues, which by the way, obesity is included, so being overweight. So you add all that together, that's 50% of our adults have one of these conditions, being obese, or having high blood pressure, or having diabetes, or having a history of cancer, or being immunocompromised, having asthma. So then the importance of face coverings really shoots up.
Let me ask you a question, because as you lead into those pre-existing conditions
Yes.
that people have, that will be an extreme danger if they contracted the coronavirus. Question is, has the medical science have seen that patients are kind of shying away from keeping their doctor visits and not taking care of those pre-existing conditions that could lead to other problems?
I'm so glad you asked that because rightfully so, when the pandemic first was introduced in the United States, the COVID-19, it was really back at the beginning of February, the very end of January. We just didn't understand much of anything about the virus, and we knew that the best thing that we could do is reduce exposure of people in the hospital where we knew we were going to have to take care of coronavirus patients, people who were very sick. So elective procedures, surgeries that were not urgent or emergent, were postponed. Elective examinations like colonoscopies and mammograms were correctly postponed. Doctor visits went to televisits so that you could see your doctor on video and still talk with them, but many of those visits were also postponed. So now we're concerned that we may have another public health crisis because we have a COVID crisis, and that is a crisis in people not keeping their cancer screening appointments. For example, our electronic health system is called Epic, and it just so happens that Mercy, SSM, and BJC are all on that same electronic health record, and so are 29 million other users across the United States. And when they looked at what were the number of mammograms that we did last year this time in 2019 versus what we've done in March and April of this year, it dropped by 95%.
95%?
95% for mammography,
Oh
95% for cervical cancer screenings, and about 85% for colonoscopies.
Wow.
And we knew that it was going to be low, but we didn't realize it was that low. But in the Epic system it is, and that is, frankly, the three health systems here in St. Louis. So I think that data is accurate because we all stopped doing these elective procedures. But now there's a prediction that, for example, for the people who have just delayed breast screenings, mammography, and colonoscopies, that there's going to be a excess deaths of 10,000 people because they are delayed in their screenings. And if we add all cancers combined, that number goes up significantly. So if there's one message I would like to get out tonight, it is that all of the health systems in our city have put in some pretty stringent precautions to make sure that you are safe going back to get screenings done. First of all, you can't enter a hospital now without having a temperature check, having a mask on. If not, one will be provided, having hand sanitizer, and the waiting rooms are not congested like they might have been in the past where you're waiting for your doctor. And the reason that we're doing that is, your safety is our priority. It's our main priority. It's why we stopped doing the procedures a few months ago, and now we realize, look, the pendulum swung way over here. We got to get back so we don't have exchange one public health crisis for another, and that is unnecessary deaths due to very treatable situations. Let's remember, with colonoscopies, for example, if a polyp, which is the beginnings of an abnormal growth, if that is removed at the time that you have a colonoscopy, then it doesn't have the opportunity to turn into a colon cancer. So a colonoscopy is not just a screening tool, it prevents cancer, and so this is an incredibly important test. A mammogram, if something is found early in a precancerous stage, survival is 99, 100%. We want to find everything precancerous. We don't want to wait until there is late stage disease where you need treatment for months, your prognosis is poor, and that is exactly what we are worried about, because we know delays in diagnosis can miss the opportunity, the window for cure. And that's where we are right now.
So let me ask you this again, because so people could really maybe understand. I think you had a very important point that by having a mammogram, the pre-cancer.
Yeah, so we
You can
call,
explain that, please.
yes, so we call precancerous lesions, the formal term is ductal carcinoma in situ. So that's a Latin term, but what that means is we have a beginnings of a pre-malignant lesion. So these are abnormal cells that over time can progress or transform into a cancer, but they start off precancerous. We have the same situation with cervical cancer. You can have abnormal cells and have what we call carcinoma in situ, meaning it's not yet has the potential to spread to another organ, get into the bloodstream, go to other lymph nodes. It's sitting right there. And we want to catch that early, and mammograms can. So about 50,000 women each year are diagnosed with precancerous lesions in the breast. We call that stage 0.
Okay.
Stage 0. That's why it doesn't have a stage 1, 2, 3, or 4. We still have to usually treat it with surgery. Sometimes we give a very short course of x-rays or radiation to sterilize the rest of the breast. But this comes with as I said, 99, 100% survival.
Wow.
So we don't want to miss that opportunity to get a stage 0 diagnosis. So mammograms, we know, detect a breast lesion 2 years before you will feel it. So we call that a lead time, where if you're doing a breast self-examination every day, you would go 2 years longer before you would feel something that could be detected by mammogram. So the importance of mammography can't be overstated. And just think about this. We are now sheltering at home. We are choosing not to go to certain places.
Right.
We are now changing our hand hygiene and our masks. We can spend an hour and go get a mammogram. Because that's saving lives too.
Right.
And a colonoscopy takes 15 minutes to do. I know the prep takes longer. But
Right.
it takes 15 minutes to do, and it's saving lives. So this year to me is about how are we protecting ourselves? How are we saving lives? We're saving lives by social distancing, by wearing face coverings, by using good hand hygiene, washing our hands after we touch door handles or go somewhere public for sure. After you touch a door handle, if you can't do that, carry hand sanitizer, at least 60% alcohol, so that you're not picking up virus that you can then inoculate into your eye or your nose or your mouth. So good hand hygiene is important too, not to forget about that. But one of our main ways that we transmit to others is through respiratory droplets. And as you said, I've seen it too. You can go places and no one has on a face mask.
Right.
And I guarantee you, if our president and everyone around him and the CDC had the ability to really get out there front and center the way we usually see them in these types of pandemics, I don't think there'd be so much confusion. And we just have to redouble the effort in our community to say, look, our community is suffering from this disproportionately for a variety of reasons. The first is that we're in multi-generational households more than other ethnic and racial groups. What does that mean? We might have a grandmother, a mother, and children, and maybe even great-grandchildren in the household. It means someone's probably going off to work and coming home. And that is the potential to transmit the virus to someone at home who may be at risk. So home transmission can be more of an issue because it's harder to social distance when you have more people in the household and more at-risk people in the household. Let's just talk about the work that you go to. We're more frontline workers. We're called essential.
Right.
But essential does not need to be expendable. And many times that means you're interfacing with the public, with people who aren't practicing social distancing, who aren't wearing face coverings, and therefore you're interacting throughout the day and giving yourself greater exposure than someone else who could say, I'm going to work from home. I have the ability to do that.
Right.
So if you're working at, a warehouse, or you're in public transportation or in healthcare, like many of us are, then you are more exposed to this. And then, you lead that to our uninsured rate is higher. So if we're not feeling well, we may not feel that we can go to the physician or healthcare provider. And so we say we're going to just, suffer through it. Or we might feel, I don't have paid sick days. I can't stop working. I don't have time that I can just call in sick. All of these things put us at greater risk for having community transmission, and it's why we see a higher rate of infection in our communities.
Oh, well, let me ask you this question. The coronavirus for the last, let's say since March 15, America became very much aware. We heard about it a few weeks beforehand. After 14 weeks of making changes in our life, this new normal we have. How long can medical science tell us how long we can expect to be in this state, not really mingling a lot, not touching a lot, not having to wear a face mask? And I'm assuming that we will, after we have a vaccine, but is there a time frame? Anyone's talking a vaccine might be
I can
available?
only go with the press conferences that you see with Dr. Fauci. And, he predicts that there might be a vaccine by the end of the year. I think that's optimistic. Most scientists who work in this area say next year. And even then, that's a global statement. Yes, you've developed a vaccine. Have we done all the clinical trials? What's the result? And then you have to mass produce it. And we have over 300 million Americans. So when we say mass produce it, in a way, we've never had to mass produce a vaccine before. And then we've got to have a way to get this vaccine to tens of millions of people. So as you can imagine, this is not something that's going to happen by next spring.
Right.
So I think we have to get comfortable with the fact that we're in the long haul of a new way of life, and each day we have to learn how to be safe. Because we thought that we were past the first wave, and I think that was wishful thinking. New York did a great job in shutting down, flattening the curve, reducing their infection rate, reducing the number of hospitalizations that they had and deaths tremendously. So is Michigan, for that matter. However, there's 48 other states.
Right.
And as many of them reopened early in the middle of this, I would say we are right in the middle of this wave. We're not past it, we're in the middle of it. And it doesn't look to me as though we're gonna go down anytime soon. We still have over 20,000 cases a day, sometimes closer to 30,000 cases a day. We have Arizona, Texas, Florida, Washington with major outbreaks. And let's just be clear, If you are doing a good job, the percentage of cases should be going down that are positive.
Right.
So no, if you're doing more testing and you're really doing a good job, if we look at other countries that have done a good job, New Zealand, Hong Kong, then the infection rate is very low, like 1% or lower. When your infection rate is going up, it's not just because you're claiming you're testing. You got cases. And cases means whether they're asymptomatic or symptomatic, you're transmitting the virus to others.
Right.
And others can potentially become sick, and others can have a worse outcome because of it. So whether it's asymptomatic or whether it's symptomatic, the point is you don't want those cases. So when you are getting more cases, it means you are transmitting. You're having community transmission.
Okay.
Okay, so whatever you hear, just because there's more testing, meaning we're finding more cases, no, that's not a good thing. You don't want to find more cases. That means somehow people are becoming infected. And that means that they can transmit to other people whether they have symptoms or not. It means some people are going to die. So what's our mortality rate?
Right.
It's about 5%. So if you have 100 infections, then you know that 5 out of 100 are going to die. You don't want that.
Right. So other countries like Italy that one time was a hot spot,
Right.
how are they faring now?
Italy, actually, let's just take the EU completely. So the European Union has 450 million people, and collectively, all those countries each day now have about 5,000 cases. The United States has 330 million people, and right now we have about 20 to 30,000 cases every day. EU is doing much better, collectively across the board much better than what we are doing. And part of it, again, is we have not heeded the message of how important it is to social distance,
Right.
to wear face coverings, to make sure that if you're going to be around people, it's outdoors. But try not to be around people at all. People are in bars, they're at the Lake of the Ozarks in pools. I mean, people are together.
Together, right.
We have outbreaks happening in Florida. The worry is they're the new hotspot. Bars and restaurants are not heeding the rule of 25% capacity, which is where they're supposed to be. They're fully loaded with people.
Right.
So they have 3,000 to 4,000 cases sometimes a day that are positive. Hospitalizations are going up. We are not heeding this. And let me get back to our community. We are disproportionately dying of this disease.
Right.
So we can't pay attention to what we see on TV, the politicization of this. We have got to heed the message that we have to stay alive. I look at this as, hey, is this a message because they want our community to have some problems? Because you're not doing me any favors, our community any favors, by not saying you need to have a face mask on, because we're out here trying to save lives.
Right.
You need to not go to bars and restaurants and gyms where you're spewing a lot of respiratory droplets, because we know that that is where super spreader events occur.
Right.
Gyms, bars, churches where you're singing. You know, we know that famous church in Oregon where they were having choir rehearsal. They came in, they social distanced, and out of 61 people in the choir, 56 got infected. A few died. We learned from that. Shouldn't be singing in an indoor space. Lots of folks in that same area. So we've got to be very careful when we come back to church. practicing social distancing,
Right.
wearing face coverings, not having a full choir, and when people are singing, just a few separated out far and wide.
Right. Right.
Anyone who is at high risk, heart disease, lung disease, immunocompromised, asthma, should not come. Appreciate the virtual service that you continue to offer.
Right. Right.
We've got to get through this until we can get to a cure, till
So-
we can get to a vaccine.
Right. So it goes, so really, everybody needs to understand that the virus is still here, and we must stay the course in order to stay well. And that goes back to social distancing,
Yeah,
wearing a face mask,
yeah.
washing our hands at least 20 seconds with soap and water, and if don't have that, Germ-X or whatever. So with the respiration bubbles, respiratory bubbles, how long do they suspend in air? I've heard different stories.
So respiratory droplets, we say
Droplets.
that they can be in the air for hours. There's even some information about the shedding of viral load into the stool, and so when you flush a toilet, you can have aerosolation that way too. And so this just gets back to face coverings.
Right.
Face coverings in public places at all times. But the aerosolation of these droplets can be more than just minutes. It can be hours. So what's the best way to reduce respiratory droplets? Wearing a face mask.
Okay.
Wearing a face mask. So this is why, again, a critical point that I like to make is that if you find yourself indoors with many people with no face mask on, singing to the music, yelling and talking and laughing and having fun, not social distancing, staying 6 feet away from each other.
Right.
You need to look at that like there's a fire on the wall and get out of there. It's
Right.
not safe.
Right.
It's
Right.
not safe. On the other hand, if you just gotta go out, think about how do I do it? You should be outside, should have your face mask on, should not be in a crowded area, and you can social distance. So to me, that means a picnic, a barbecue. But everybody has to,
Social distance.
so you can still be social. We're human. We're human. We want to be around each other. We want to see friends. We want to see families. We want to go to the movies. Maybe, drive up movie theater. We got to do something creative and it has to be an alternative to what we're used to doing.
Are you able to speak to the psychological stress? Have doctors talked about this? That we were designed to be social,
Yes.
we're designed for touch, and with the elimination of that, is there anything that medical science recommends for people to do to stay mentally healthy and emotionally sound?
That's a great question. It's just a great question, and I'm feeling for many people who spent time at church almost every day of the week, and that was their only socialization, or even at nursing homes where they can't socialize anymore together. They all have to stay in their separate rooms. It is incredibly tough. I would say the important thing is to find other ways to engage, because we know that depression and melancholy has gone up, skyrocketed because of this. And luckily, through technology, we have a lot of people learning how to use their phone and to FaceTime with people and have partners that they can call every day and talk to for long periods of time. You know, you can still go by and visit your loved one, social distancing, maybe outside, 6 feet away. So you can still meet with people, particularly someone you used to see all the time and you know that they are living alone. It's important for us to have these connections.
Okay, very
So I think Zoom is another avenue. But I will say we know it's an issue. We know it's a problem. And you can even have mental health visits through televisits, through FaceTime. So that can continue.
Okay, good. Now, going back to the fact that in the African American community, that we are dying disproportionately. And you hear it on the news, we've heard about it for the last several weeks. And the problem we keep hearing are the underlying health issues. What would you say to somebody who could be watching who has some health problems but have not addressed them? Maybe feel they don't have the money or don't have insurance. Is there anything that you could suggest to them what they can do to get checked out?
Absolutely. So again, we've got some great federally qualified health centers that offer health care to the underinsured and uninsured. Betty Jean Curves People's Health Center is one. Myrtle Hilliard is another. And even going to BJC as well as SSM, we all have funds available because we recognize that there is an uninsured population, and we recognize the uninsured population is higher now as many people have lost their jobs. So there are avenues, absolute avenues, to receive care in this city and county, in this region. And I would say going to our main healthcare centers is one, but also going to our federally qualified health centers are another. And Peoples has a clinic out here, not too far away. And we have Myrtle Hilliard or centers. And we have Barnes West, Christian, St. DePaul Health Center and St. Joe's, St. Mary's. All of these centers offer care and have charity care too. But you bring up something that is incredibly important. For Missourians, the most important thing that we can do is on August 4th, in the primary, we can vote for Medicaid expansion. Medicaid expansion, we should have had over 8 years ago.
Right.
We have been paying for the Affordable Care Act. It has been coming out of our federal taxes, and we have not benefited from the fact that over 300,000 Missourians will be cared for under Medicaid if we vote for Medicaid expansion. Right now, to this date, we have lost $7 billion that have not come back to the state of Missouri because we didn't expand Medicaid. We've have 36 other states that have Medicaid. That means that more people are covered. and insured so that they can go to their doctor's appointments, they can get their prescriptions, they can get their screenings. And yet we have more people, sometimes over 25% uninsured in certain zip codes in North County because we did not expand Medicaid. So August 4th, we need to get the services that we've been paying for.
Okay.
And it's just a tragedy that we have been paying this out of our taxes. And due to politicization again, we have not received the health care that we should have. And we have people struggling to get basic screenings when they have actually paid for it in their federal taxes.
Okay,
So vote yes for Medicaid expansion. Vote yes.
Yes,
Okay.
ma'am. So everybody needs to vote. If you're not registered to vote, get registered. If you have impurities, do your absentee ballot.
That's
To check on that. It's very important. We vote and vote for Medicaid expansion. So that 300,000,
We have 300,000 people throughout Missouri,
300,000 people.
who would be covered that are now struggling, cannot get insurance. And most of these people are working families. And that has been some of the misinformation. Oh, we're just handing out. It's going to make the state, balloon up in terms of the amount of money that they have to pay per person. No, 90% of Medicaid is paid by the federal government. That is the amount we're not getting.
Wow.
And our federal taxes have been paying for it.
Right.
So the state is on the hook at the most for 10% and no more than that.
10%.
At the most.
So everybody who thinks that Medicaid expansion is going to bankrupt the state.
It's just not true.
Not true.
In fact, what we're finding is we're missing out on what could be job growth. There's a thought that we're missing tens of thousands of jobs in the healthcare sector because of the contraction of people who are not using our healthcare system because they don't have insurance. We've had over 10 rural hospitals in Missouri.
Right.
There should be no one in the rural areas who isn't voting for this. First, your federal tax dollars pay for it, and your hospitals are closing because you've got an uninsured population who is not utilizing the services of the hospital. So that's not good for your community, it's not good for jobs, it's not good for health. Same here.
With one vote, with your vote, you can open it for 300,000 more people to be covered for health care. Also, it will create more jobs.
Create more jobs.
That's above minimum wage, good living jobs.
Healthcare industry is our main industry in Missouri.
Right.
Good jobs.
Good job. So and then the rural areas that don't have lost hospitals
Right,
will possibly be able to have the coverage they need.
right.
But it all goes back, everybody, to one thing. You have to get involved.
Yes,
You have to vote.
yes,
Don't wait for the president to do it.
right.
This is something you could do yourself.
That's right. And the president can't do it because each state has voted to expand Medicaid or not. And again, we've got, I want to say 36, might be 37 states that have already expanded because they know the math makes sense. We're over here doing a nonsensical math equation. The numbers aren't adding up.
Right.
We're paying into it. We're not getting the healthcare services and insurance we deserve. And yet our health indices are lower than other states because, one, we can't pay for the screenings. Just doesn't make any sense. The math doesn't add up.
No, it does not. It does not at all. So, Doctor, it really it seems like that the coronavirus has kind of opened Pandora's box. is showing all of the frailty and the brokenness of our society. And who in our society is also suffering the most. And so what we need to do is, for instance, people are excited that restaurants have reopened to a degree. Stores have reopened to a degree. In the next few weeks or so, in Missouri, churches will be reopening, but what advice would you give to churches so they don't think that they can just come right in and just go like gangbusters, business as usual, that someone may say, I'm coming to church and I want the freedom, but we want to come back to church, but in a group that's protecting one another, so we can come well and leave well. Is there anything you want to address to that?
Well, I would say I think our state, but mostly our local guidelines have given good direction in how to open.
Okay.
The first thing I would say, and this is just really coming from the guidelines, is if you have a health condition where you know you are high risk, so that includes, again, heart disease, lung disease, being immunocompromised, having asthma, obesity, all of these measures don't make you necessarily more susceptible, but if you do develop the disease, you may have a worse outcome. And we don't understand why, meaning a higher risk of needing hospitalization, a higher risk of needing ventilatory support, a higher fatality rate with these, what we call other health conditions. The first thing I would say is, you know, many, particularly if you have hypertension and diabetes, multiples, it might be important to consider continuing to practice your faith virtually, using your virtual platform that you have. Right. If you choose to come, the hope is that the leadership will have developed guidelines of the way that you enter into the church, so that there isn't a lot of passage of people, that when you're sitting down, you're 6 feet away from each other. I can't emphasize enough how important it is to have face coverings.
Right.
Again, we know that we've had some of the more concerning super spreader events in churches where people have not had face coverings on and were doing a lot of singing or talking. But just by virtue of being in church, we usually, you know, I grew up Baptist, so it was a 3-hour service. The longer, the more exposure you have, the more concerning it is. So we've got to find a way of shortening the service. Shouldn't be any passing of the offering plate. All that needs to stop. Anything that would require transmission from person to person. Going through doors, it's better to have doors open so that people don't have to touch the door handles.
Right.
There's a different way that you sanitize cloth seats versus leather seats, and that has been pretty outlined by the CDC and how you will do a sanitizing process of the sanctuary, and having lots of hand sanitizer available, and obviously having reduced capacity. And I think it's also important to consider having events where, as you know, you can go get tested for free with no symptoms in many places now, but encouraging maybe something like that after a couple of weeks that you have service going on, to just make sure that you know, with regard to your congregation, who may be a carrier of disease, who may have asymptomatic presentation or has COVID and didn't know it. So I think I am not an expert in that area, but those are some of the thoughts that I would have for just thinking about how you may want to open. And the overall, the philosophy that I would have is, you're here trying to save souls, which means you're trying to save lives.
Right.
So we have to think very long and hard about opening back up when we know that exposure can be a life-threatening event for some of our parishioners in our congregation.
Right.
So we have a heaviness here in what we're about to do. I know when I go to work, I can't go into the hospital without having a temperature check, ask a whole myriad of questions, and then I can't see patients without being all COVID protected up from them, so I don't transmit anything to them, and I don't contract something that I could then go on and give to other people that I see throughout the day. And we've got to look at that very much the same way. You don't have to put all that gear on, but almost every other step, making sure that people who are coming know what the signs and symptoms are, so they're not coming and they're sick.
Right.
That's key. If you're sick, you have any myriad of a symptom, and these symptoms are a lot. Loss of taste, loss of smell, shortness of breath, cough, fever, diarrhea, so headache. So all of these questions that you might want to put out there to your congregation about, if you have any of this, please don't come.
Well, thank you. It's because in the Christian community, people miss the coming together. But if we really are going to do as Jesus said, love thy neighbor as thyself, that would also be applicable to, if you know you're sick, don't feel well, stay home.
Right.
If you do come, adjust to the protocol of the day. If your church is taking temperatures, accept it, don't fight it. Wear a mask, and keep your hands clean, as much as clean, and social distance yourself, and then leave well. And don't. The biggest thing for church folks is what? Hugging and shaking hands.
And I bet you haven't seen anyone in 3 or 4 months. You don't want to hug everybody. It's going to be tough.
Right. But right now, people are going to have to refrain from hugging and shaking hands, because we will hug with a good intention from our heart. We want you to be well. So, Doctor, going back to the other conditions that from what you told us, people are not going for their pre-screenings, missing their doctor's appointments, and the projected possible increase of death rate from these, that where if people that went for screening could save lives. Is there anything you would like to say to urge the public to really take care of their overall health?
Yes, and that is, we cannot substitute what is going to be a public health crisis for sure, because we have forgotten about taking care of ourselves. High blood pressure is also called, the silent killer, because there are no signs and symptoms. And if you are missing your doctor's appointments or your healthcare provider appointments, not filling your prescription anymore, then you are putting yourself at risk for stroke and heart attack and kidney failure because you have not kept up with your doctor's appointments.
Right, right.
Same with diabetics. If you're pre-diabetic or you knew, your doctor was saying, hey, you're right on the cusp, your hemoglobin A1C, in fact, we need to start this medication. You were on the fence and then COVID hit and you didn't go back, then it might be that you really need medication now. You need a counseling on diet and exercise to try to get that blood sugar under control. And if you're missing health visits, again, you're putting yourself at risk because diabetes is a risk factor, a main risk factor for kidney disease, losing your ability for your kidneys to make urine, or for your, unfortunately, for you to have good perfusion in your arms and legs. You can lose limbs with diabetes. You can lose sight if uncontrolled blood sugar. So we know that this is happening. But I am an oncologist, and I know that many cancers are curable, particularly when found in early stages. Prostate cancer in men is the most, prostate cancer is the most common cancer in men. And for African American men, they have a much higher rate of developing prostate cancer and over 140% higher mortality than white men from prostate cancer. And this particular cancer is absolutely curable if found early and manageable. And a simple blood test called a PSA costs $35. Simple blood test can help give us a snapshot of the health of the prostate gland. We know that only 35% of men are screening at this point, 35% of age-eligible men. Wow. And we know that number's a lot less right now because people are not visiting their healthcare providers. When we have cancers that we know are curable and treatable and manageable if found and detected early. And let me say something about finding cancers early. When you find them early, usually the treatments we have to give are a lot less difficult to take. Many times there's no chemotherapy involved, the surgery is minimal or there's no surgery involved. The radiation might be 1 week or 1 day, or if you do what's called a seed implant for prostate cancer, 1 hour to get that done. So finding and detecting cancers early typically means the treatments are not as difficult to undergo, and the success rates are high, 90%. So I can't stress enough the importance of looking at the year of 2020 as the year of, I just got to concentrate on me and stay alive. I got to stay alive because COVID's out there. I got to stay alive because I got to get back in with my doctor and manage the health conditions I have and prevent the ones I don't want to have, and detect the ones early that I might have. Because we don't want to keep we don't want to get distracted. And there's a lot of distractions going on right now. And there's a lot of things we have to do. We got to vote. We got to vote. More than ever this year, we got to vote. On the local level, the state level, and the federal level. We have to vote. So there's a lot of responsibility we have to ourselves and to our community this year. And it is around not just making sure we get back in the game to get to work, but it's voting, and it's also our health. But it's really our health. This is the year that we have to focus on our health.
Thank you. Dr. Hall, I want to thank you very, very much taking the time to come and to share with everybody. I just want to encourage everyone this. You heard from Dr. Hall today. And we wanted to do this program to remind everybody the coronavirus is still here. Not for fear, but to be wise. That we keep our social distance still use our masks, still clean our hands. Remember, it's not just about you. It's about the people you're around. You want to care for them. And I encourage you to do all you can to reduce your stress level. Don't stress yourself out, and make sure you take care of your entire health, that you get your annual physical and get your screenings done, because we got a lot of work to do. 2020 has been an exciting, turbulent year, but it's a year that we could all say, thank you, Lord, for how you have brought us through. And as you do return back to your houses of worship or to your jobs, remember, we have our brothers and sisters to think about. And the last thing I say, that Dr. Hall said, vote. Make sure you vote in August 4th. Make sure you vote. And remember this, your local elections affect your life immediately. Every 4 years we vote for the president, but you got to deal with those local elections that affects your environment where you live today. And let's go out and vote for that expansion of Medicare. So God bless you all. Have a great night. And remember, we love you to life. God bless.